Okay, so our community group project presentation is on drug abuse by Rebecca Podesta, Karina Orozco, and Virginia Powers. So drug abuse is defined as the use of an illegal or prescription drug in a way other than intended that is detrimental to self, the society, or both. Abuse of illegal drugs can cause increased tolerance and dependence, which in turn can cause withdrawal symptoms and increased risk of overdose. In San Joaquin County, our rate of drug-induced death is 56% higher than the average rate of the state of California. 49% of 11th grade students have actually reported being high from drug use, compared to the 36% across the rest of California. So, symptoms of abuse. Some symptoms of opioid abuse can include inability to control opioid use, psychomotor agitation, pupil constriction, reduced respiratory rate, drowsiness, slurred speech, depression, uncontrollable cravings, changes in sleep habits, weight loss, and isolation from your friends and family. With methamphetamines, you may have symptoms such as nervousness, hyperactivity or irritability, twitching, jerky movements, dilated pupils, paranoia, extreme weight loss, outbursts and mood swings, rotting teeth, skin sores, acne, burns, particularly on your lips and fingers. With hallucinogens, you can experience paranoia, synesthesia, which is talking about tasting colors or hearing images, euphoria, increased blood pressure, heart rate, respirations, and temperature. You can have loss of appetite, poor judgment, disassociation, loss of balance and uncoordinated movements, and unusual perceptions of time. With stimulants, you can experience risky and impulsive behavior, elevated blood pressure and heart rate, twitching. You can have deceptive behavior, such as lying and stealing, paranoia, and hair loss and weight loss. So these are just some further effects of opioid abuse. So your short-term effects are going to consist of things like constipation, nausea, and vomiting, sleepiness and dizziness, depression, confusion and paranoia, and respiratory depression. Long-term opioid abuse can result in tolerance and increased sensitivity to pain. You can also experience physical dependence, liver and brain damage, and possible coma and even death. With methamphetamines, some of your short-term effects are going to be increased blood pressure and temperature. You're going to have faster breathing, fast and irregular heartbeat. You're going to have nausea, loss of appetite, disturbed sleeping patterns, and irritable and violent behavior. If you're on methamphetamines for long term, you can experience permanent brain and heart damage. You can also experience damage to your lungs, kidneys, and liver. You can even experience paranoia, hallucinations, and violent behavior, or itching that results in sores from scratching. If hallucinogens, some of your short-term effects are going to be feelings of relaxation, nervousness, paranoia, panic reactions, increased heart rate, elevated blood pressure, hallucinations, and impulsiveness. Your long-term use effects of hallucinogens can consist of persistent psychosis, which is disorganized thinking, mood disturbances, paranoia, and visual disturbances. You can also experience hallucinogen persisting perception disorder, which consists of hallucinations, other visual disturbances such as seeing halos or trails attached to moving objects. Symptoms sometimes are mistaken for neurological disorders such as stroke or brain tumor.
So some stimulant effects for the short-term use are going to be loss of appetite, increased heart rate, blood pressure and body temperature, nausea, sleep disturbances, panic and psychosis, convulsions, seizures, and death from high doses. And then your long-term use effects are going to be permanent damage to blood vessels of the heart and brain, high blood pressure leading to heart attacks, strokes, and death, liver, kidney, and lung damage, damage to tissues of the nose if snorted, breathing problems if smoked, infections and abscesses if injected, malnutrition, psychological dependence, psychosis, depression, and then brain damage, including strokes and epilepsy. Some of your risk factors are going to be coming from young adults ranging from the ages of 18 to 25. If you have a family history of drug abuse, people with traumatic experiences, environmental factors such as family members or peers who have used illegal substances or abuse prescription drugs, healthcare professionals with access to prescription drugs, people with chronic pain from underlying conditions, people with undiagnosed ADHD, people with mental health disorders, and people with known substance abuse disorders. Some preventative measures are taking your medications as prescribed, avoiding mixing illegal and prescription drugs with alcohol and other substances or medications, especially other drugs that can cause drowsiness. Some examples are benzodiazepines, such as Xanax, muscle relaxants, hypnotics like Ambien, or opioids. You want to avoid sharing or selling prescription drugs. Store prescription drugs in secure places away from others. Contact local pharmacies or the police department for information regarding proper disposal of unused prescription drugs. Many pharmacies offer mail-back programs, and some drugs may be flushed down the toilet. These are some health resources. So there's a Substance Abuse and Mental Health Service Administration with the National Helpline phone number for you. We have the National Suicide Prevention Lifeline, San Joaquin County Behavioral Health Services Access Call Line, and a couple websites, the mytimerecovery.com, where you can find drugs and alcohol treatments that are in your area. And there's also a Narcotics Anonymous located in Stockton, California. And you can also find further websites on your local government site. The prevalence of the illness in a community with limited resources. San Joaquin County has a higher rate of substance prescription drug abuse compared to the rate across California. Based on the 2016 CHNA report, Stockton fares low on the American Human Development Index, showing 1 in 4 residents living in poverty. Between 2014 and 2016, San Joaquin County's rate of drug overdose deaths was 345 per 100,000 people. 15.5% of adults in San Joaquin County drink excessively daily or almost daily. Drugs such as methamphetamine are also a common problem. Methamphetamine use is one of the largest reasons for individuals to seek rehab in Stockton alone.
Okay, so objectives for the community with limited resources include reducing substance abuse to protect and improve the health and safety of communities, facilitating community resources and directories that list prevention, treatment, and recovery services available, informing, educating, and empowering communities to change the social norms and community conditions that facilitate drug use, developing drug support groups where others can share their stories, encourage each other, and find ways to manage their recovery. Benefits for the community of the health resources are a safe and supportive environment, improvement of the quality of life of themselves and their community, lives saved, lower crime rates, and reduction in the number and costs of injuries and violence, better realization of goals, and a more promising future. And Healthy People of 2020, the goal is to reduce drug abuse to protect the health, safety, and quality of life for all, especially children. The overview: in 2005, it was estimated that 22 million Americans struggled with a drug or alcohol problem. Almost 95% of people with a drug or substance use problem are considered unaware of their problem. And why is drug abuse important? It has a major impact on individuals, families, and communities. The effects contribute to social, physical, mental, and public health problems such as teenage pregnancy, child abuse, domestic violence, motor vehicle crashes, and suicide. Understanding drug abuse. People argue over whether drug abuse is a genetic disease or a personal choice. Advantages in research have led to the development of evidence-based strategies to properly address drug abuse. And here are our references, and we thank you for listening.